Very warm welcome again. So today we have a special topic, sir. We have an agenda of a very vital organ of the body, which is heart. So I believe many subjects in the India or other countries of the world as well underrate this subject, which is cardiovascular health, because probably maybe they don't know about it, how to prevent cardiovascular health. And nowadays we are getting many news from the gym as well regarding heart attacks within the subjects who do gym training. So I wanted to know why so.
So I also have clients who, whenever this news of heart attacks, they see on Instagram or on television, they kind of tell me, itne sare heart attacks ho rahe, so they get concerned due to the heart attacks, happening in the gym. And my counter question to them is often that, how many heart attacks have you heard about or seen in the gyms and in the whole year? And they would normally say, I've seen, at least heard a dozen heart attacks happening in the gym. So my response to you, 1 dozen, right? All right, that means that's a good thing. You should go to the gym. And their response is like, a dozen people are experiencing heart attack. So isn't that a scary thing? And I'm like, let's not consider 1 dozen. Let's consider 500 people have died in the gym due to heart attack. But do you know the actual statistic? How many people actually die due to heart attacks? At least 5 lakh to 10 lakh people die out of heart attack every year in India. So do you want to join gym and be in a club of only 500 people, or do you want to remain unhealthy, not go to the gym and be a club of 5 lakh to 10 lakh people? So it's often this, if you take care of yourself, then the chances of heart attack or anything is obviously going to be lower. So it's just that, if there is news about people dying in the gym, it gets all over the news. That's why it gets scary. But the reality is that only a small percentage of people, that's, we are comparing 500 to 5 lakh or even 10 lakh, and it's not that the gym caused heart attack. It is just that they were they might have created an environment for heart attack. It has just happened to be that at that point they were in the gym and they experienced the heart attack. Even regular people, it's not that out of those 5 lakh people, everyone experienced heart attack in the gym itself, at home itself. Some must have been in the office, some must have been at shopping center and things like that. So gym is definitely, this should not be the reason for people to be scared of not going to the gym. Because at the end of it, it's like saying a couple of my neighbors' kids have failed, so we will stop sending people to school. So that's not going to happen, right? Just because few heart attacks incidents you've heard, we all know that school is still a great place to learn, to upgrade yourself. So gym again is a great place to improve your health.
So, meaning this is the misconception in the subjects of the mind that the heart attacks are directly or indirectly related to gymming. Subjects should even go to gym even after hearing the news of heart attacks among other people, because there are very few in proportion. They should not stop gymming because of hearing the news of heart attacks in dozens of people, because according to statistics there are many people having heart attacks even if they don't go to gym or they go to gym.
True.
Yeah. So my next follow-up question would be, like when subjects are going to gym, is many subjects I have seen, they lift heavy weights. So is heavy weight lifting related to your heart health?
So, see, heavy is a very subjective term. Like say, for example, a person is 5'10", 5'11" in India. It is considered like a good height, But if the same 5'10", 5'11" guy goes to US, it is considered average height. If the same person goes to China, it is considered good height. So similarly, weight is a very subjective term, What if you see a person doing 30 kg dumbbell chest press in each hand? So you may feel that, okay, this is a heavy weight, but for him it must be still be lightweight. The forces that the weight is incurring on his body, be it muscular wise, be it joint wise, or be it heart wise, that body, what you are seeing is someone who is on his journey 6 years down the road, and after that he is doing that 30 kg dumbbell chest press. So he has cultivated, he has honed his body to that level where even that 30 kg is not feeling that heavy for him. But as a general population, let's say if you're going for the first few months, so even 10 kg will, the forces that you experience from 10 kg will be far more for your body than the person who is doing 30 kgs. So on the, from the general eye view, you may feel that, okay, he's lifting a lot of weight. But what that force reaction is, what that reaction of force is doing to the body may be far less than what 10 kg is doing to a beginner. So that, and here is where beginners do mistake. They see, okay, this guy is doing 30 kg, but they fail to inculcate the fact that this is 6 years or 5 years or 4 years of his gymming, and then he is doing 30 kgs of dumbbell bench press. And then as a beginner, you see someone doing 30 kgs, you feel that, oh, I should also try 20 kgs or if not 30 kgs. And when you subject yourself to such heavy load, then we can say, okay, this is heavy for you, because now your body or your heart or your joints are not prepared for this weight. So just by looking at the weight number on the weight, 20 kg, 30 kg, 40 kgs, we should not directly come to the conclusion that this is heavy weight. Heavy subject to what? It will be heavy if your body is not ready, if your heart is not ready. So if your question is whether heavy lifting can cause heart issues or any other issue, it depends. If the force application is poor, you are not ready, and you are subjecting a weight that your body is not ready to. Your capacity currently is, let's say, is 10 kg. Now you're trying to do 20 kgs just because you've seen someone do heavier weight. Then that can be problematic in terms of joint issues, in terms of muscular tear, or even in terms of some heart strain. So it's all about, not heavy lifting by itself is problematic. The problem lies in people doing random stuff, not being aware, being less guided, or not taking guidance from someone. And if they subject themselves to poor force application, which the body or the heart or their central nervous system is not prepared to, then that can be problematic. So heavy lifting is not problematic by itself. People doing random stuff, just looking at others and trying to mimic them, that puts them in a risk category.
So true. So heavyweight lifting is subjective, you mean to say.
Yes.
It depends on different subjects. People who is a beginner may find 10 kg a heavy weight, but people who is a practitioner may find 40 kg a heavy weight. So it depends on the stamina and application force of the subjects, like how much to lift a weight. But still, if the subject is poor in force application and he is trying to pull a heavy weight, then it might affect
it
their
will be
heart.
problematic.
Yeah.
Yes.
Also, I have seen some subjects believes that they take nutrition supplements in gym. So are some nutrition supplements responsible for poor heart health?
See, supplement, again, you have there can be different categories. If you're talking about steroids, then definitely these are substances that can cause harm to the body. You may grow muscularly, but internally the body can weaken, as in the heart, kidney, liver. All of this can have some negative impacts. So it's when it comes to gym, we have positive adaptations as well as negative adaptations. So if you're taking any substance externally, especially those along the lines of steroids, then definitely, especially not under guidance, then that can be problematic. But when we talk about regular supplements, which is taken to cover up the nutritional deficiencies that we are not getting through normal diet, like whey protein, creatine, or omega supplements or multivitamins, those are absolutely fine, provided you know that the brand, it's because there is a lot of duplicacy in the market. So you should often consult your coach and see which brand is good enough to to purchase supplement of that brand. So, and yes, as long as you are taking a supplement to meet your nutritional deficiencies, and that too from a good brand, there is no problem at all. And some pre-workouts have some, not so good stories. There were companies which had some banned substances in the pre-workout, and also pre-workouts, let's say the main ingredient in that is caffeine, and let's say if it has 200 mg caffeine and you overdose, let's say instead of taking 1 scoop you take 2 scoops, that's 400 mg, and then someone in the gym says, okay, try this new pre-workout, and that also has, let's say, 400 mg. Now you're going to the gym with 800 mg of caffeine in your body. That can be a bit problematic for some people. Since we are discussing heart health, yes, it can have some influence on heart health, because now when you're working out, the blood pressure, temporarily blood pressure, heartbeat, all of that rises with that caffeine. Again, you have given it more stimulus to rise, and with that heavy caffeine dose and with that rigorous activity, you can invite some heart issues, health issues, temporarily. You might even faint and all. So with pre-workouts, especially you do not know about the ingredients or you're less educated about it, then you may want to be a little watchful. Other supplements like creatine, whey protein, omegas, and all of that's health supplements, they are definitely beneficial. Like, look at it as, see, our body does not know where the nutrient is coming from. It does not even care whether you're providing nutrients through food or through supplements. What it cares really is about the nutrients. If you cannot provide that nutrients from food, then provide it to supplement. Supplement is a convenient and a more natural form. You can look at it that way. Let's say, for example, there is a plant called ashwagandha. Mm-hmm. Now that plant, I've heard that some of the leaves or something are little poisonous, but ashwagandha by itself is like, it's very health beneficial. It reduces stress. It has a good track record as such, in terms of health benefits. Now if I do not want to derive the bad effects of that let's say poisonous plant, and I just want only the good effects of it, so what can be done is that the only alternative is I cannot pluck and eat it raw, because I'll get some harm from it. So what can be done is only the good component will be extracted from it and made into a supplement form. Now I'm getting all the good effects without any negatives. Similarly, the same goes with, let's say, pre-workout. The main ingredient, as I said, is caffeine. Now if I do not want to take pre-workout, I can derive that caffeine even from black coffee. But black coffee, again, some people experience digestive issue. It has some anti-nutrients, there are tannins in it. So if I do not want even the side effects of black coffee, then what I'll do is I will take only a caffeine pill. Mm-hmm. So I'm getting that energy, that alertness that I need for my workouts from a caffeine pill without any side effects of any potential side effects of any pre-workout or even of black coffee. So supplement is beneficial, provided you have someone telling you, which brand is good and all, and you yourself know that, okay, I am actually deficient in it. Otherwise, there is no need of taking supplements which you're not deficient in. We are taking supplements to meet some nutrition deficiencies. So if you are deficient, then it makes total sense. It makes 100% sense to derive that nutrients from any supplement.
So you mean to say the supplements should be taken with the advice of guided coach or nutritionist?
Yes, to avoid any downsides of, and to avoid any duplicacy problem. Because now what is happening with supplements, we are placing a lot of trust on some third person, mm-hmm. because at home our mom cooks, so we know that it is coming from a good source. Mm-hmm. But with supplement companies, there are so many companies, mm-hmm. we can't blindly trust any company hoping that this will come out good, Mm-hmm. So it's better that the coaches, we have some insider information as coaches. So it's better to take to depend on coaches for these information so that they can guide you in the right direction.
But I have seen personally, there are many nutrition companies who market their nutrition supplements in such a way that subjects tend to buy it blindly. Mm-hmm. So what is your advice to those subjects?
See, marketing, the main goal of marketing is to attract people, and so subjects have to be, a lot of people, the problem in fitness is that everyone thinks they are the experts, mm-hmm. that I've noticed. If you spend few years in the gym or if you transform yourself, so all of a sudden you think that you are an expert, you can take all the decisions by yourself, but that is not very true. People should stop that self-reliance and should take guidance from someone who has some degree or someone who has done some certifications in that field. That way that they can stay, protected. Again, even as a coach, if I advise you some supplement, it is not that I own the company, so I cannot 100% bulletproofly have a bulletproof guarantee that this is the best bet, but we are just improving our chances of getting the best product.
But I believe in the developing countries, we don't have many nutritionists who are certified and who have done their own research to a level so like they can guide the subjects. So how important it is for the subjects to get good nutritionists and how to research about them, especially when it is related to their cardiovascular health.
See, nutrition is different, and exercise. When you talk about, cardiovascular health can be improved with nutrition as well. So, yeah, makes sense. So, see, anytime you were to hire a coach, so you will obviously, take some references from people. This is how it works. Either these days people hire coach based on references. You got results, then you will recommend, that person to. So this is more of a blind trust where my magic worked on you, so my magic will work on that person as well. So that person will not do too much interrogation. He will just describe his goals to me, and then we will discuss the action plan and all of that. In this regards, generally what I have noticed when it is a referral, people don't investigate much. They have this blind trust. Okay, it is coming from you, so I will enroll. So that is one way. Second way is, of course, these days social media marketing. So people approach coaches through social media messages, DMs and all. So in that case, the person will have to do some research on his own, check the Instagram pages, and normally what I do is I do a one-on-one consultation call for 30 minutes before enrollment. In that, I give the client the liberty to ask any question about my credibility, if they want to see my certificates, if they want to see client transformation, and if they even want to speak to a couple of my past clients, I give them that liberty as well, so that they have this peace of mind before enrollment.
So true. It is necessary to have some peace of mind that this is a good coach. Not definitely, but 70-80% I might get the results. So
Yes.
this is in the mind of the subjects before hiring a coach.
Yes, but here also I have noticed some problems is, the coach, some clients get influenced every now and then by what they see in social media. So my advice to all my clients is always that do as much research as you want before hiring the coach. After that, don't second down. Blindly follow what the coach gives, because after that, once the plan is created, once you're supposed to follow this, after that you have second guesses and then you put in half-hearted efforts, then you're not going to get results. So first, do as much research as you can before enrolling under a coach, and then blindly follow that. Don't use your own mind. I've seen a lot of people make this mistake even after having a proper action plan. Follow this, you are going to get 100% result. Still they use their own brain, and then they do something random things on their own, be it diet wise, be it workout wise, when the action plan is this has gotten results to hundreds of people. Do this. I have helped hundreds of people with this similar manner. You are not something different. You are the same species, so you are also going to, of course some customization is done behind every plan, but more or less it's humans. We are still going to eat carbs, proteins and fats, and exercise is more or less same. It just varies based on if you have injury, what is your current fitness level, and based on that some customization is done. But more or less if you second guess if you have doubts after enrollment, then you are digging a deeper grave for yourself, because you'll not get results. You'll end up wasting your money.
So it's a Carry. Do your own research
before do as much research as you want. But after enrolling, don't second guess.
Yeah. So I have seen many subjects who look fit. They look good. Their body shape is good, but still they have poor heart health. So why so? Like their body looks very much good, but their heart health is not that much good. So
So good in terms of you can say he looks slim and he's not out of shape. That is one way of looking at good. And second way of is obviously this person, you look at him and you can tell he's working out. So this first person who may look decent shape and size, but he's not working out. This person, although he may be thin, in the fitness terminology, there is a word called TOFI. Thin outside but fat inside.
Oh.
Meaning that he will be thin all over his body, but he will just have belly fat. That is, you may know, we call it visceral fat. So even though he may be thin, but if he has a lot of visceral fat over here, which is fat around the organs, this person may be more subjective to any pathological condition, or like diabetes, or liver issues, fatty liver, or even heart complications, compared to a person who may be 10-15 kgs heavier but does not have a lot of visceral fat. So visceral fat, some people, as you may know, we met a person who was working out with us today morning. If you look at it, he is more heavier than you, weight wise, but his fat distribution is pretty much all over the body. So he does not look like a fat guy. He looks more like a football player or a rugby player. So I even told him that you have good genetics, even though he could not recognize it, but I told him firsthand itself, you have good genetics. Just put in 1-2 years of sincere effort, you will put behind people who have put in 5-6 years of effort, because of his good genetics, which an experience I can tell just by looking at it, by the way his workout, some veins even at such a higher body fat percentage start to show, so you can tell this guy has good genetics. So it is not always that thin or slim determines your overall health profile. Some people can be very thin and very slim, but still metabolically their health may be deteriorating. But overall, in general, be it thin or fit, if you're taking care of your health, if you're working out, if you're incorporating good eating, sleeping habits, less of stress, this person who has healthy habits will obviously have a good cardiovascular health overall, compared to just profiling a person based on thinness. He may be thin, but he may have some metabolic conditions.
When it comes to cardiovascular health, we have some terms into picture. It is blood pressure and heart rate. So how do you determine what is the normal heart rate and what is the normal blood pressure of the subject?
Normal blood pressure is generally between, for most individuals, is between 60 to 100. That means if you are within this range, your heart is performing. It's not beating too fast. It's not working too hard. You're not like overworking your heart. But sometimes, if you are in a stress situation, it can go up temporarily beyond 100. But generally, the resting heart rate should be between 60 to 100. Above 90 is still considered high. That means you are along the lines of unfit. So you don't have to take any medication or anything, but you have to start taking care of your health so that you can bring it down. And so basically, the more closer you are to 60, that determines good overall heart health. So athletes and the regular gym goers, they may even fall in 50 levels. In athletes, cyclists, they even fall in 40, mid 40ish level. That shows that how relaxed their heart is, at resting rate. So heart rate definitely is somewhat of an indicative of how good your heart is, but it's not necessarily a strong indication, because for example, I know a runner who used to run 10-15 kilometers. He was a regular runner, but his heart rate was, genetically his heart rate was more aligned along 80ish. It was, so there is some genetic truth to it, but more or less for most people, the lower the heart rate, it is better. More along the lines of 60-70 is better, rather than being on the higher side, 90-100. When it comes to blood pressure, it is 80-120. You see two numbers, systolic, diastolic. The systolic number has to be around 120 and diastolic is 80. That again is an indication of heart health, because earlier this number was 140 and 90. Then they did some study and found that that at 140 and 90, if we have this kind of numbers, it still puts a person in a little bit of health risk cardiovascularly. So they brought down this number to 120-80, where they found out that this is a sweet spot where they can be no negative consequences, because heart is also a muscle. It keeps pumping, you know. If you see in movies and all, they show that dhak dhak, you know, that heart is a pumping, and that number, you know, 120, if it is 130, that means the heart is it is doing more work, it is contracting harder. And that resting heart rate, which is the diastolic number, which is 80, if it is 90, 100, that means again, even at rest, it has to work hard. A little bit of degree of stress is involved. The arteries, veins are not all that relaxed. That's why the number is showing 90, 100 instead of 80. But here again, the higher the heart rate, the higher you are at risk of any cardiovascular issue. That's why, and blood pressure is one thing which can go unnoticed for years. You can have high blood pressure for 2, 3, even 4 years, and suddenly you may not even realize until you may start seeing some negative side effects. You know, so that's why it's very important, especially very important to get your blood pressure checked every 3 months, 6 months, especially once you cross 40 and all. But younger population also now, given how the scenarios is these days, work from home, unhealthy eating, they can, at any age, you can start checking your blood pressure to see if it is in normal range. Also, one more thing I want to point out is there's something called white coat syndrome.
Okay.
Now, what that means is that white coat, who wears white coat? Doctors, right? So what that means is, if you are at a doctor's clinic, you get your blood pressure checked, it may show 190, 140, 90. The numbers may read this high, and that is just because of the nervousness of the clinic settings. If you come back at home and if you check, it might show 120, 80.
Yeah.
So this is called white coat syndrome, and that's why if in a doctor's clinic, if the numbers show high, you should not immediately start medication. Some doctors may put you on medication, but you should not, you know, be open to that medication scenario. You should get checked again. You will have to go go tomorrow, then again go tomorrow. Simultaneously, also check at home. If it is constantly above 90 in home situation or at a setting office clinic situation, then definitely you will have to take medication. But just because once it is showing a higher reader, you should never start medication, especially if you do not have any history of BP.
Meaning the environment also matters. If you are in a stressful environment, you might get the higher numbers in blood pressure or heart rate. But if you are in a peaceful environment like home or resting, you might get the lower.
Not lower, whatever your normal is.
Yeah, normal numbers. Yeah, so it is very much necessary to test again and again.
Yes, especially if you're checking at home, you'll have to check 4 or 5 times throughout the day. Because so in the morning you may be stressed, so it will come higher. In the evening you're more relaxed, work is completed, so it will come. So you'll have to check it many times to actually before starting medications, because any medication in the long run has some negative impact.
And take the average of it. Moreover.
No, you will not do anything calculations on your own. Eventually, you will have to, you know, go to the doctor and he will make the final call.
Final call. Okay, cool. So I have also seen personally, when I run on the treadmill, my heart rate is normal. But when I increase the speed, heart rate goes above. So running or movement also have a direct impact on.
Of course. Any movement you do, the moment you start any movement, depending upon how intense the movement is, the heart rate keeps shooting up. So if you're doing mild running at a very slow pace, there will be some increase in heart rate. The faster you run, the more heart rate increases. Same with any physical activity, be it if you're even doing strength training, if it is too intense, the heart rate spikes up. So activity is always involved in, you know, heart rate spike. That's why it's important when you have any heart related issue in advance, you'll have to disclose it to a coach, and the coach will check with your cardiologist how much hard exertion can your heart take. And this is where, you know, if I do any workouts which your heart is not ready for at the moment, then gym environment can be a bad place for you for the time being. So I will always have to check with your cardiologist how much exertion can your heart take, and accordingly I will have to apply forces on your body so that which your heart can handle based on your current fitness level. And that way, as I expose your heart and your musculature to a certain dose of stress, that the heart can handle currently, then its capacity increases, and then it's able to, the heart performance improves. But if we are again doing random stuff without catering that this guy has an heart issue, and we are exposing them to a higher degree of force that the body is not currently in a situation to handle, then again the heart attack that we discussed earlier in the gym scenario can occur.
With this comes a big questions for the subjects, like what are the major factors which affect your heart health, and what do's and don'ts you should follow for your good cardiovascular health?
See, cardiovascular health, first if we talk about nutrition, then we can go to discuss about workout as well. Nutrition wise, of course, we have to eat as much as possible, eat healthy foods which are not high. Let's say, for example, we discussed about blood pressure. The blood pressure rising is also, these people who have been identified by for blood pressure should not be consuming too much of salt, whatever 2300 mg, which is around 6 gram of salt, is recommended for most of us. Now let's say if a lot of people, they eat Maggi, and at a time they eat 2 Maggi at once, because one is not enough. That 2 Maggi at once is equivalent to the daily dosage of salt. So 2300 mg will just get from one meal. So now throughout the meal, whatever you eat, rice, chapati, little bit of salt we keep adding, right? And let's say instead of having a mixed vegetable, I'm having 6 different vegetables. Salt will come from this vegetable, this vegetable, this vegetable, rice. So daily intake of salt will rise, then BP will rise, then heart issue will rise. So that's why it's important to in a nutshell, if I were to tell, for good cardiovascular health, avoid eating outside food which you have no control, how much salt, how much preservatives, how much trans fat is involved, all that unhealthy stuff, how much of it is involved, we never know. When it comes to rice, if I make anything out of rice, you can tell, okay, this, be it dosa, be it rice, you can tell the original that this is made from rice. But if it is a cake, you cannot tell what it is made of. It can be made of anything, simple cutlet, it can be paneer cutlet, it can be any maida cutlet, you don't even know what its originality is. So with home, we know what is the originality of that, be it if it's a wheat ka chapati banao, bread banao, kuch bhi banao, we know the originality of it. So once we know that, we can eat that, without any consideration whether it will cause harm to our body or not. So mostly I would say packaged foods like chips, chips, cookies, cakes, all of that should be avoided. Outside samosas and all of that, in terms of maintaining a cardiovascular health. Because if you notice, one of the things that causes great harm to our health is trans fat. Now most of the trans fat you will get from the samosas and vada pavs, or anything that is prepared from outside. And the reason for that is that it is not that the samosa or vada pav, I am defaming them, it is just that क्या होता है, जब when we are preparing samosas at home, we cook it, and once the cooking is done, we do not reheat the same oil, we throw away that oil. But when you look at an outside setting in a food stall and all, the same oil reheat, same oil again. If a fresh batch of samosa comes, the same oil is used. So ideally oil should only be used once or twice. But in an outside setting, they use it 10-15.
They want to maximize their
profits. Yes. So every time you reheat oil, the trans fat in it increases. So if you go by the time it's evening time over there, and it's 20 times the oil is already heated, and that samosa is just one samosa, but it can do a lot of harm. In fact, cancer and all we have associated with, in India, cancer is growing by the rate of, I think, 3 or 5% every year, and trans fat and these is one of the culprits for this. So again, when we have a lot of these trans fat, arteries plague up, meaning that blood, if let's say this is how thick your arteries are, so this will keep narrowing up because there's some plaque development, and the blood will not pass through, the blood volume will get impacted, and that's how some of people get cardiac arrest or heart attack. These are different terms, but this is one of the reasons. Nutritionally, try to, as much as possible, try to avoid packaged and outside food. When it comes to exercise, see, any activity that you do, is going to improve your health. It can even be yoga, it can be strength training, it can be cycling, any activity, physical activity, it can be sports. Any physical activity improves your heart health. But again, it has to be the physical activity stimulus, which should be based on what your body can currently handle. If the body can only handle this much, but this much forces, external forces provided from outside, be it in terms of weight, be it in terms of too much running, what the body cannot currently handle, then that also can be problematic. Poor force application is always going to be problematic in terms of joint health, in terms of muscle growth, in terms of back pain, in terms of metabolic conditions also. Poor force application is always a problem. Even if everything has to be done in progression, weight wise also, start with maybe 2.5 kgs, then 5 kgs, then 6 kgs, 10 kgs. Running also 1 kilometer, 2 kilometer. Everything has to have a proper training protocol. That way, if you follow this principle of workout and diet, you can kind of say improve your cardiovascular health, and at the same time, stress and proper sleep also plays a good role in improving your cardiovascular health.
I have seen many subjects who are muscularly appealing and lucrative, but they tend to put pacemaker in their heart. Even on social media and TV, I have seen interview of many people who are muscularly appealing, but they tend to put pacemakers. Why? So what might be the reason behind
because
that?
of course there is some dysfunction in their heart. The heart is not functioning as it's supposed to. There is a node. It starts with the name S. I don't exactly remember the node's name. That node is the natural pacemaker of a heart. Due to any dysfunction to that natural pacemaker, an artificial node, a pacemaker is installed. So you can actually see that on their if they are without clothes, you can actually see that square shaped node that acts as a pacemaker that regulates the heartbeat, and whatever the heart deficiency that person has, it takes care of that. I don't know the expense and how frequently it is to be replaced, but I think once it's planted, it stays for many years and beyond. But again, this has to do with a lot. It has to do with the genetic. A person may have some genetic default, which we can't do much about it. Even if you, let's say for example, even if you are taking care of your health, but if you are genetically predisposed to type 1 diabetes or any heart issues, then that will come into your life. It's just that healthy lifestyle will still allow you to recover faster, can prolong that arrival of that condition. But some people, some diseases, some people are predestined to that because of how the manufacturing, I would say, for lack of better word, how the manufacturing defect, I would say. But beyond genetics, when it comes to bodybuilders planting pacemakers in your body, it can also be due to steroids, or I would say substance abuse. If they are taking steroids under, see, steroids also is a very catchy thing. Even if you take under guidance, it can still cause you harms because it's an external thing that you're putting into your body, and you never know how the body is going to respond to any foreign object coming in. So in such scenarios, even with proper guidance, you can have a situation where the natural pacemaker can get harmed in any shape or form. In that scenario, a pacemaker is installed. It's quite visible on the chest, and that does the job of the pacemaker that got hampered.
So heart is fully made up of arteries and veins, which are responsible for supplying blood to and fro in the body. So how sleep of the subjects is concerned with the heart health?
See, sleep has a great significant role. In fact, you can do everything right in terms of taking care of your health and eating right, but that one negative of lack of sleep can hamper a lot in terms of, not just in terms of, let's say if you're trying to lose weight or build muscles, it's going to, and if you're doing everything right nutritionally, training well as well, but most of the good positive things happen in our body when we are sleeping. Recovery happens when we are sleeping. So you are bringing a lot of positives, but this one negative can bring a lot of downsides, which can negate a lot of negatives. And cardiovascularly, again, the same same thing. You may be doing a lot of things right, but due to lack of sleep, the body is not getting, let's say for a mobile, we recharge it every night, so that it can function at its best in the morning. So mobile functioning is always best when it is fully charged. So similarly, if we are not getting a body through sleep an opportunity to be fully charged, whatever you do after, after a sleep deficit, it's always going to be not so good for even productive wise. Let's say a lot of people say we will sleep just for 4 hours and be more productive, but ultimately if they had sleeping for 2 more hours or 3 more hours more throughout the 16 hours that they did with a sleep deficit, whatever work they could have they completed in 16 hours, with a good sleep they would have actually completed in 14 hours maybe, who knows. So similarly, so that way sleep has a very great role. People should take as much sleep as possible, as it could be 6 hours for some people, it could be 8 hours or even more for some people. The more the better, but again, if we are sleeping more and we have it should not be like you are sleeping more and you're not getting anything done.
You get a lethargy.
Yes, it should not, too much is also not good, but 6 to 9 hours is a good dose of sleep for most people, and it should be given a top priority as well. Just like you're prioritizing, if you're a healthy person, if you're prioritizing workouts and diet, you should also prioritize sleep in the same fashion. It should not be a second thought. It should often be one of those top priorities for you for good cardiovascular health.
If some subjects are following their diet routine properly, going to gymming, getting a good sleep, still they are getting intuitions or getting some warning signs that their cardiovascular health is not at a good pace. So what warning signs they might be, and how the subjects can handle those warning signs?
See, warning signs can be anything. It can be palpitation, it can be anxiety, it can be rapid heartbeat, it can also be lack of sleep. So it can be anything. So it's better to do an ECG done when you suspect anything related to heart. But it is not always that ECG gives a clear picture. So just like in this, if you have anything related to bone, there is this X-ray which costs only a few hundred rupees. But if you want a further screening, MRI needs to be done, right? It goes into detail and tells you more about that particular joint which is injured. So ECG gives a surface level picture, but it may not always give a good picture of the heart health. So something like a total calcium test or heart echo test, that would be equivalent to an ECG for joint health. So you can do further more tests also there. So further screening would be required. If you have done an ECG, if it gives you peace of mind and if the symptoms go away, then it's totally fine. But if after ECG is clear, and even if you are experiencing some heartache or some tingling sensation around your passing through your limbs and all, and if you want further investigation, then these further tests can be done, like total calcium, heart echo test. Further tests are available to have that sense of security. This is not a temporary anxiety or lack of sleep related symptom that I'm experiencing versus symptoms that is associated with any heart problem.
So everything is temporary. If treated well, you can cure and go for a better heart health. Correct?
Sorry?
So whether it be palpitation or any other issue is a temporary thing when it is treated well by a guided.
We don't know. See, the medical report will tell you whether it's temporary or something of permanent of nature. Some people may require heart stents and stents put in their heart and all. So it depends. It's just that the earlier the diagnosis better, so that if you identify something early, maybe you can even prevent a surgery or something along those lines.
So prevention is better than cure.
Yes.
If you treat early signs well, you might get better heart health if you treat them late.
Right. The outcome would be better if you diagnose something better.
Yeah. So my follow-up questions on this would be, what nutrition in the home perspective, like mom's food or thing, what type of nutrition you would suggest to the subjects for a better cardiovascular health?
So better see whatever, if you notice, whatever is good for general overall health and well-being is the same good for most pathological conditions like or cardiovascular issues. So whatever is good for general health and well-being is the same is good for something like diabetes also, or thyroid issue also, or pieces. Some few food exemptions or exceptions are there. Like for example, in thyroid you cannot eat cruciferous vegetables, although it's healthy. We can have in small doses, well cooked, but general some little bit exemptions are there. But in general, the more healthy food that you eat is, which is good for your general health and well-being, the same food is good for cardiovascular health also. Not intaking too much sodium, not intaking too much sugary drinks, not intaking too much of fast foods. All of that, for most people, they already know what is good in health, what is good or what is bad for their health. It is the implementation part, and sometimes of course lack of guidance comes into the picture, but mostly in general people know rice is good, chapati is good, sandwich is still good, but
But I have also heard few exemptions now, like in chapati there is a gluten substance, so you should replace the chapati with jawari and bakri nowadays because of sedentary lifestyle. Earlier chapati was considered as a good.
See, chapati is also fine. Chapati is also fine. Every food, if you notice, will have some positives and some negatives to it. Like we discussed coffee, it is good for energy-wise, for alertness-wise. Alertness-wise, it is good, but it brings some downsides like digestive distress, and it has some anti-nutrient profile. So even with rice, if you eat too much of rice, it will raise your blood pressure, So, but it is still a good food. Chapati, it has gluten. It is just a protein property of it, but it's still overall a good food. Millets also, too much eating is not good because it just has a lot of fiber. We also do not want to overdose our body with fiber, and it also has some anti-nutrients to it. So even when it comes to jawar, bajra, millets also have some bad properties to it. Soya, a lot of people consume soya for protein, but it has a lot of anti-nutrients, isoflavones, phytones, and a list of anti-nutrients are there. Even nuts, nuts and seeds, if consumed in small doses, it is fine, but in higher doses, because of their if you look at seeds and all, these are the most protected part of the plant. So why would a plant want to protect it if you think logically? It is not suitable for too much eating. That's why plant protects us. For us, we can run when we are in danger. Plant can't run, so it will protect it in some shape or form. So that way, anything, even if healthy, if you're talking about nuts, seeds, soya beans, anything healthy, even if that is, even millets, if that is consumed in excess, it can cause issue. So you should always have variety of foods. You should not depend only on millets, only on chapatis, only on rice. Identify healthy foods. We know for the most part chapati will bring more positives than negatives. For the most part millets, rice will bring more positive than negative. Whereas if we talk about bread, samosa, all of that, this will bring more negatives and less positives.
Correct.
So identify foods that have more positive, less negatives, and even if it has little negatives, as you said, gluten in chapati, it is still fine. Consume more of those things that bring in more positives to our health and overall well-being, and keep a variety. Even if it's fruits, there is this old saying, an apple a day keeps a doctor away. But that's not true. Apple, for a fruit to be given that kind of classification, it should have all kinds of minerals and nutrients in it. Apple is nowhere close to that in terms of nutritional profile. Peru is far better nutritional, has a far better nutritional profile than apple. And every fruit will have something to bring it which would be unique to that. For example, banana is loaded with potassium, orange has a good dose of vitamin C, so, and guava has good dose of vitamin C, potassium. So we will have to incorporate variety, so that, because as I said, the body only cares about nutrients. It cannot tell whether this is an apple or this is an orange or this is that or that. It just wants nutrients for its effective functioning, to discard of metabolic conditions, for overall health and well-being, for muscular performance, for body composition, for mood regulation, because our gut also there's a there's something called serotonin. So that is a happy hormone. 95% of it is released from our gut. So if a person's gut is only disruptive, then you are depriving yourself from a lot of healthy, happy hormones. So eating healthy also ensures that you are having a good health. As a result, as a consequence of that, you can also enjoy good mental state.
Mood.
Good mood, yes. And again, a lot of people say, I cannot follow this diet because I have a lot of cravings and this and that. They do not realize they are having cravings. One of the reasons could be because of their bad gut. Now, to improve that for at least for certain period of time, they will have to follow a good diet, whether they like it or not, so that gut restoration happens, and as a consequence, the cravings will happen less.
Yeah, so true. So also I have seen the beliefs of many subjects that white skinny people tend to have more issues with cardiovascular health. How true it is?
See, when it comes to skin color, it is all based on melatonin. And when it comes to Western countries, they sunbath themselves. And because less of melatonin is also not good. Not necessarily cardiovascularly. I'm not sure what pathological conditions are associated with it, but too less melatonin, and as a result too fair skin is also not good. So that's why they take sunbath and all. But as a skin color has very less influence on overall health and well-being.
So is melatonin directly or indirectly associated with
no, melatonin is not that word. I forgot what it's called. Melatonin is related to sleep. I forgot it starts with M, but I forgot the exact word.
Okay, so is it directly or indirectly related to heart health?
No, not
the hormone.
Not really. A fully white American can be hale-hearty, good, have cardiovascular health than an African. There is some genetic realities in terms of races. Like normally we see the Africans are genetically gifted with good cardiovascular as well as good overall health and well-being because of their race, and that's why you see a lot of sprinters and all people perform well in the Africans perform well in that area. But it is even if you are if you genetically blessed, and if you are disregarding your health, you can be far worse health condition than someone who is not genetically gifted but has taken care of his health.
Yes. So what will your final message to the viewers?
Since this topic is about cardiovascular health mainly, I would say, see, our heart is always a working muscles. It works for us 24/7. It never takes rest. Even when we are sleeping, it keeps working. So we may want to return the favor by taking care of it, by at least devoting some time for physical activities, at least 30-40 minutes of some physical activity, so that we are taking care of something that is taking care of us all the time. So take care of your health, don't disregard your health, incorporate some physical activity, take care of your nutrition, that way your heart can stay healthy. And you can a lot of people tell me that going to the gym and all of that involves discomfort, and I would say I totally agree. For some people it will cost you comfort, but if you're not taking care of your health, it will cost you everything. So decide whether you want comfort or you want to lose everything, because in the hospital bed, lying in the hospital bed, if it's a life and death situation, you will tell the doctor, take everything but save me.
Yeah. So this will be my final message to the viewers, like take good sleep, do meditation and spirituality, go for gymming. This will not only save your cardiovascular health, but the overall health, and also improves your overall physique. So thank you so much, Ranjit sir, again for this scintillating session and enriching us for this wonderful piece of information regarding cardiovascular health. I hope it will help all the audiences of this podcast on a long run.
Thank you, Akash.
Thank you so much.